Hello, I'm Heather Sheridan with Allina Health Cancer Institute. Today I'm here with my colleagues, surgical breast oncologist Dr. Karen Hendershott and our medical breast oncologist, Dr. Bronagh Murphy. Thank you for joining me today. I'd like to do a little bit of myth busting with you. People often have some anxiety when you hear the word breast cancer or talk about breast cancer. So, what is one myth that you'd like to take a minute to bust? Dr. Murphy, do you want to get us started?
Yeah, I think what I hear most in the clinic when patients come in with a diagnosis of breast cancer is say, take them both off, right?
Mhm.
And so people think that if you do the bilateral mastectomies that you're going to be done. You're, but it doesn't really do anything for your risk of recurrence of the breast cancer you have in different places. And that's what we're focused on to get a person cured. So even though bilateral mastectomies make sense for some people, they certainly don't make sense for everyone.
Thanks. Dr. Hendershott?
Yeah, I think for me the biggest myth and the one that I worry about the most because I think it's what keeps patients sometimes from getting their screening mammograms or speaking up when they sense that something isn't right in their breasts is that breast cancer is a death sentence. And it's just not. The vast majority of folks who get diagnosed with breast cancer are going to do really, really well long term. They're going to go ahead and live full, productive lives, go get back into the things that matter to them. And so I really hope that you aren't scared of breast cancer, that you're willing to do the things you need to help protect yourself and keep you safe.
Now, let's spend some time on a question that younger patients might have about breast cancer. What should younger people know about breast self awareness?
Yeah, so we moved to this phrase breast self awareness instead of breast self exams about, I'd say, 8, 10 years ago. Because there was some data that suggested that self exams wasn't really helping us diagnose things early. And it was scaring the heck out of some people because they didn't know what they were feeling. And so
Mm.
they were coming in terrified that what was actually normal breast tissue was a cancer. So these days we talk more about breast self awareness, which can include self exams if you're comfortable doing them, but also paying attention to changes within your breast. So,
Mm.
obviously, if you find a mass in your breast, you need to go get it checked out, even though most of those turn out to be nothing. But in addition, you want to pay attention to things like discharge from the nipple. So, if there's clear or bloody fluid that's leaking out of the nipple, we want to pay attention to that. If there's persistent changes in the skin of the breast, that's concerning. It might just be a rash, but it could be a less common version of breast cancer. And I also have patients come in and they just have a sixth sense that something isn't right. And they may even point exactly to that place. So if you have a sense that something isn't right in your body, even if the imaging's okay, please push forward and make sure that you get some answers or at least are followed closely so that if imaging does miss something, we catch it soon afterwards.
Yeah, that's really great. Does taking birth control increase my risk of getting breast cancer?
The short answer really is no. It doesn't increase one's risk like significantly. In years past, there used to be like a much higher dose of estrogen and progesterone in that birth control. But since the doses have gotten really small, right, the risk is really negligible. But there may be a very slight increased risk in breast cancer taking oral contraceptive pills, but when you stop the oral contraceptive pill, it totally goes away in about 2 to 5 years.
I think what's interesting to point
Yeah,
out too, if you don't mind my chiming in, is
yeah,
that we do know that birth control pills reduce your risk of developing ovarian cancer.
Hmm.
So,
yeah.
as we're kind of weighing the pluses and minuses, there's some added benefit for other types of cancers that you might get from oral contraceptive pills.
Yeah,
Yeah.
that's true.
Even before getting a mammogram, you should be checking yourself for cancer. You mentioned that from a self awareness perspective. When should you start that? And what should you do if you feel a lump? What's kind of that next step and what do you do?
Yeah. So, I think the first question is if you feel something, the first thing you're going to do is call your primary care person or your OBGYN and say, hey, something seems wrong. And they will likely do an exam or have you simply move forward with imaging. And that's called diagnostic imaging. That might be an ultrasound where they use kind of sound waves to look at the fluid and tissue in the breast and see what's going on. It might be a mammogram. It might be both. But that's usually where we start. In terms of people who aren't having symptoms, for the average risk person, we talk about starting mammograms at age 40. Okay. The challenge is, who the heck is average risk, right? We don't always know. So certainly if you have a strong family history of breast cancer, particularly at younger ages, we talk about starting imaging 10 years earlier than the youngest person in your family who got diagnosed. So if they got diagnosed at 45, you'd start your mammograms at 35. And then also sitting down again with your primary care person and having them do some risk calculations to see if you have other factors that might put you at higher risk of breast cancer and might prompt earlier screening.
Helpful. Are there any signs besides lumps that people should pay attention to?
I think actually, yeah, there are some things that people should pay attention to are changes in the nipple, or sometimes if you see a redness on the breast or you see some skin changes on the breast. So all of those things, pain necessarily isn't really a big indicator of cancer, but pain also, you should alert someone about that. Those are the other things that I would say.
Yeah, helpful. Are mammograms safe, and how much radiation do they use?
Yeah, that's a frequent question that we get. And the reality is, going in for your yearly mammogram subjects you to the same amount of radiation as you decided to take a flight to one of the coasts, right? And you don't get any medical benefit. You might get mental health benefit, but no medical benefit from taking that airline flight. So mammograms are definitely safe, but they're not 100% accurate, right? So there are always a chance that we may miss something on mammograms. So just because you recently had a negative mammogram, if something new pops up in the breast, you still need to go ahead and get it checked out, particularly if you have denser or thicker breast tissue. And you can find out if you do on your mammogram report these days.
What's the difference between a 2D and a 3D mammogram?
So a 2D mammogram is when they squish you one way and they squish you the other way, and they take those two pictures and they look at it. A 3D mammogram is where they still squish you, but they're not as hard. And then the camera rotates around the breast, so it takes multiple pictures. So I describe it as trying to kind of look inside a book just by kind of squeezing it as hard as you can and seeing if there's something inside, versus opening that book up and flipping through the pages. So what we find is that 3D mammograms are better, particularly in dense breast tissue, at finding smaller things, and also avoiding these things called false positives, where they call you back to get second sets of images done and it turns out to be nothing. And so the 3D mammograms seem to reduce the chances of that happening.
Can you both offer some advice to someone who's simply looking to lower their risk for breast cancer? What can a person do?
I think the most important things in looking at, increased risk of breast cancer and how to lower your risk, things that you can control, would be things like, for postmenopausal women, obesity. That one is very important. The next one that we have an association with increased risk of breast cancer, or at least breast cancer recurrence, when you have breast cancer, is increased alcohol intake, so that you can have control over. A low-fat diet has always been associated with a lower risk of breast cancer, although there have been some mixed, reports on that. Keeping your body weight closer to your ideal body weight is really important. The other thing is exercise. Exercise is also important for not only lowering your risk of breast cancer, but many other cancers besides. So those are the things you can control.
I think that's a great answer, and you hit all the major things that I would mention. I think the other piece to focus on, though, is that some of this isn't in our control, and it's so hard. As a breast cancer patient, you start going back and trying to figure out why you're sitting here. And the reality is, your largest risk factor for getting diagnosed with breast cancer is being born female, and it's the estrogen in our system that sets us up for this potential diagnosis going forward. Certainly, you want to live a healthy life and do all the things you can to lower your risk. But despite all that, there's still a chance that you may see this diagnosis.
Every day you're dealing with breast cancer. What brings you to work every day? What gives you hope for the future as it relates to breast cancer and this diagnosis?
I think I've been fortunate in that I've seen a lot of changes in breast cancer because I've been practicing for over 25 years. So it has gone from, especially in the treatments that I do, so the treatments have gone from being really toxic chemotherapy down to, we've de escalated it down to antibody treatment, immunotherapies, what we call antibody drug conjugates. All those treatments have much less toxicity than our traditional chemotherapies. So the thing that gives me hope is that the drugs that I use are ever changing and we're getting better and better. Even every 6 months we have changes. And that actually has given me a lot of hope for patients in the future.
Great.
Yeah, I think I echo a lot of that. Survival rates for breast cancer continue to improve, which is really important because the incidence of breast cancer is going up, and so survival going up is really valuable. And I think as a surgeon, I'm often able to do smaller surgeries than I did when I first started treatment. So just like Dr. Murphy's able to do kind of more focused medical treatments from a surgical perspective, I'm very much more able to tailor the surgical approach to the disease process and to the patient's goals. Because that's really important as well. Each patient kind of walks into the office and has different outcomes that they want and need to get to the other side of this feeling whole and intact. And I think that ability to help people meet those goals and meet those milestones in their life is just amazing. And I'm so lucky to do what I do.
Thank you both for taking time to answer some of these Mythbuster questions. Thanks everyone for joining us today. I appreciate Dr. Murphy's and Dr. Hendershott's time. And if you'd like to learn more about breast cancer treatment at Allina Health Cancer Institute, visit allinahealth.org and enter the term breast cancer in the search bar. You'll find more answers to frequently asked questions, information about our providers, and Allina Health Cancer Institute locations.